Hi there, thanks for joining us for our monthly webinar. My name is Sarah Snable and I'll be the presenter today. I'm one of the co-founders of PROergonomics, and today we're going to be talking about tablet and laptop ergonomics for field workers. With the ever-changing technology, it's becoming more and more common to see laptops and in particular tablets right now in the workplace. Desktop computers are almost being phased out. Really, we're seeing more and more people use the laptops and the tablets, maybe who have never really used computers before, or they're using them to replace some of their desktop computer tasks. Definitely we're seeing fewer and fewer desktop computers, and we're definitely seeing an increased usage of tablets in the workplace and these mobile devices. So the focus for today's webinar will really be on field workers, so people who are using laptops and tablets more on the road, or these mobile workers. Maybe they have a dedicated office space, but not always. Let me tell you just a little bit about PROergonomics, just in case you're not familiar with us. These are a few of the services that we do offer. We are consultants, and so we do, office ergonomic assessments, ergonomic risk assessments, where we identify the hazards and compare them to some ergonomic guidelines and standards, and then present some possible recommendations to help improve the job or reduce the risk of injury. By all means, this isn't a comprehensive list of our services, but if you are looking for some more details, you can check out our website or feel free to contact us. Again, a little bit about PROergonomics and who we are. Alexandra, Jennifer, and myself are the partners in PROergonomics, and we all hold a certified professional ergonomist designation. It's a relatively unique designation in the sense that there's not really a lot of people in Canada who have it, but it does mean that we've got some comprehensive education and work experience in the field of ergonomics. As well, we're all registered kinesiologists, and we've been doing consulting for several years now as well. We've worked as in-house ergonomists, so between the three of us, we've touched on so many different industries and seen a lot of different jobs, anywhere from manufacturing to healthcare to school boards to government and corporate offices. So really together with our team, we really provide a well-balanced, a well-rounded a bit of experience, and so therefore we really help to work with you to customize the solutions in terms of how you can address some of those ergonomic hazards, your force, your repetition, your requests for sit-stand stations and treadmill desks and all the sorts. So we love to connect with our current clients via our webinars, and if we haven't yet worked with you, please don't hesitate to reach out. We love to talk with you about anything that you might be working on for ergonomics, or anything that you're thinking about working on. We're confident that our rates are competitive, and so with our passion for ergonomics and our team approach, we always guarantee a high level of customer service. For today's webinar, I'll just go over some of the key points that I want to touch on. So first we'll talk just a little bit about tablet and laptop design. Laptop design is pretty straightforward, but we'll just touch on some of the challenges with tablets as well. And then talk about who is using them. So kind of when we talk about field workers, what types of tasks are they doing, what types of challenges or successes might they be having, and some of the common injuries or discomforts that might be being reported. And then we'll go through some examples of some ergonomic solutions or things to take into consideration when you are trying to make changes in your jobs. So just a reminder on what MSDs are and really what the goal of ergonomics is. I know it seems basic to review this, but these are the type of injuries we really want to focus on as we talk about tablet and laptop use. So soft tissue injuries, these are these musculoskeletal disorders, these MSD injuries, and they happen over time from repeated exposure, frequent or prolonged use, awkward postures, high forces. There's a couple of different key risk factors that can lead to these MSD injuries or these strains and sprains. But the key thing to note is they take time to develop. It's often years or months. So since tablets are relatively new, especially when we're talking about them being used in the workplace, it's possible that some of these potential injuries that we think we might see from using tablets, that they might not yet be evident in your workplace, or maybe you're just getting some of the early signs of them. So just keep that in mind as we go through. I think that tablets and laptops in particular can have some great benefits in terms of efficiencies and convenience, but we do want to be cautious that we're not creating further injuries or further hazards by, trying to increase efficiency and convenience. So when we talk about our tablets, they're similar to a laptop. Let's take a step back really and talk about laptops. So a laptop, obviously, you've got a small screen and a keyboard, and they're all built into one unit. It folds in half. It's nice and compact. You can fit it in a bag, take it with you. And a tablet is really almost the same, except that you've got your keyboard and your keyboard and your screen all in one, right? So your touch screen, that's your input device. It's not now. It's no longer separate from the screen that you're viewing, which actually makes it even more portable than a laptop. It's more lightweight. It's smaller. It makes it even more convenient in some ways because you can use it in even more locations. So you can hold it in your hands or support it on your arm. It can sit on your lap. If you use a case for it, there's maybe even some different options that it can sit in your lap or in different spots on your desk or a table, and different mounts as well, arms that can mount it and position it in different angles. So there's lots of kind of bonuses, and they all seem great. We also have some user posture differences because you can't angle the screen independently. It kind of depends on how the person uses it, how they choose to hold it, what they're doing. So we see a whole lot of different postures out there, but in general, we are seeing a lot of looking down or that neck flexion, and we're seeing a lot of kind of, I'll call them awkward shoulder and wrist postures in particular. And then some of the limitations, if we think about a tablet, really is that it's bigger than a smartphone. So smartphones, I know, are going around everywhere. They're in your pocket. So often a tablet's a little too big to be carried around just like everywhere, like a smartphone. It doesn't really fit in your pocket. And then sometimes they can be a little bit slower too if we're comparing them to a laptop, and even then comparing that to a desktop. So a desktop is the more powerful unit. You can open several applications, whether it's gaming or different software that you might be using for work. A desktop computer is usually much faster than a laptop, although laptops have made leaps and bounds, and they can do, almost everything that a desktop computer does. And tablets, I have no doubt maybe that they will catch up in the future, but right now they don't quite have the capabilities in terms of managing all those different software programs, and so, that's definitely one of the limitations for them. Some of the places that we're seeing tablets used are, I've got a couple listed here, and obviously you can think about where you might be using them in your workplaces, and we can add to this list. But some of the workplaces that I've been in recently, visiting some clients, I've seen some inspectors, lots of inspectors using them. So people who are going out in the field, maybe they're using a checklist or some kind of a form where they're having to document notes. So maybe a building inspector, an electrical inspector, a revenue inspector, for example. I've seen all of these types of positions using tablets lately. Just last week, actually, I was in my local library, and I noticed that the library staff were using tablets. So the lady that I saw in particular had a strap on her laptop, so she was wearing it over the shoulder, almost like a purse, and she was walking up and down the aisles of books. So she was using it to help customers, whether it's to look up information, see if they had a book in stock, for example. So I thought that was kind of a neat application. I've seen several enforcement officers. So parking enforcement, for example, is one that I was in not too long ago, and they're not using a full tablet. They are actually using a smartphone, but their smartphone will actually they can do all the issuing of parking tickets right there on their smartphone. So I thought that was pretty cool. They carry around a little Bluetooth printer, and they can enter in, the license plate and the street, the intersection where they're at, enter in the infraction, and then it prints out a little piece of paper, and there you go, there's your parking ticket. So that's kind of an interesting application as well. Lots of sales reps, the beauty of a tablet is that it can also play videos. You can show pictures, so it's kind of an interesting way of getting your sales pitch across, or doing some extra marketing or engaging with your customers. healthcare, like doctors, for example. I've been seeing them carrying them around lately, where they'll enter in their patient notes, or maybe it's even a way that they can fill out like a requisition form for other services, and then it can quickly get sent off to, that lab, for example. Another area, and this would be an example of an area where maybe they haven't been using computers very much in the past, would be some tradespersons. So I know, for example, I was meeting at a municipality, and their HVAC workers and plumbers and electricians, they've all started using tablets to get their work orders. So they receive their work orders on the tablet. As they do their work, they enter in their notes, kind of what's been done, when they did it, what parts they used, etc. They enter all that in on their tablet, and then they close out the work order on the tablet. So they've really tried to limit the amount of paperwork, and because those guys are all mobile, they didn't necessarily need a desktop computer. So I mean, for right now anyways, the tablet seems to be working well. A couple other places that we see tablets used are more in vehicles. So in warehousing environments, I've seen a lot of forklifts will actually have a tablet or a version of a tablet installed right on the vehicle. So they'll have, for example, it might have their pick sheet or their order sheet, and so they know which aisles to go up and down to pick the product, and they can just use the touch screen to say, yep, they've got it, or it's linked with their scanner. Lots of firefighters and paramedics. I know some of the firefighters that I've seen recently, they were using a GPS system, and they've since transitioned over to more of a tablet type device. So that not only can it access maps to help navigate them, but then it also stores other information or resources or references that they need. So for example, MSDS sheets that they might need when they're on site at a call. And then a lot of the other people who maybe have their laptops set up in their vehicle, and that is their office, like the inspectors and the sales reps, they might have a laptop or even a tablet where it's like more physically mounted into the car. So as I was trying to do some more like detailed research, really I was trying to look for some research on what's out there on tablets, what do we know for sure, what kind of injuries are they causing, and has there been any tried and true or some researched solutions on them. And there's actually not really a lot of research out there, but there is this one that seemed to come up quite frequently. A lot of people seem to be referencing it, and it's a study on the different tablet postures, and they looked at 4 different user configurations. So they had their subjects come in, and they had 2 different styles of tablets, and they had them sit in these different positions and do tasks. So sometimes it was checking email, it was browsing on the internet, it was entering in some simple data, or watching a video, like a movie, a short little video clip. And they had them sit with the laptop, or the tablet, just in their lap, or they had it sit in their lap but the tablet was in a case, or they had it sit on a table with the tablet in a case, and then they had it again sitting on the table but propped up at a steeper angle, and in this case they weren't doing any input, they were just watching a movie. So these were the 4 different postures that they look at, and I mean, I think you can kind of tell, it almost, a picture says 1,000 words, so it goes without saying really that the worst neck postures, right, and they were only looking at head and neck postures, they weren't looking at health outcomes, so they weren't saying that you are at an increased risk of injury or what specific types of injuries they might be causing. But when the users were handling or holding the tablet in their lap, that's when they had the worst neck postures, so they were looking down the most. And then the best neck postures, and I mean they're still not even perfect, but the best neck postures were when the tablet was set up on the steeper angle stand when they were just watching a movie, so there was no touch interaction other than to start and stop the movie. But obviously this isn't this doesn't translate directly into the field, because it's very rare that we're just sitting there watching a video. Most often we're looking at interacting with the tablet. So we're trying to see how can that apply to our field workers. So just a couple things to note from this study in particular is that, remember, it was only looking at head and neck postures. It wasn't looking at shoulder, wrist, hand. It wasn't even telling us like what types of injuries we are at risk for. And so what we need to do, I think, then is take that and compare it to what we do know. So we know from other research studies and case studies and even anecdotal evidence that the more extreme the posture, the greater risk of injury to our soft tissues because it's causing increased strain. So we see this in all joints across our body. So therefore, I think we can conclude that tablet users may be at a high risk or a higher risk of developing neck discomfort based on, how they're using the tablets, and that is based on how tablets are designed. So I think that this study's results can suggest that continuous use of tablets for longer durations, it sounds like they're suggesting to place them on a higher surface or like a table surface with that steeper angle. However, the steeper angle may not necessarily be great if we're doing a lot of input with our hands, right? If we're having to do data entry or typing of any type. So, if we're looking for this research support, then I think further studies are going to need to be done to really look at the effects of tablets and their configuration on these wrist and arm postures. But again, like I said, there's lots of research out there that shows that the more awkward the posture, the higher the risk of injury. So, there's no specific guidelines right now on tablet use. So in terms of length of use or what posture you specifically should be in when you're using it. But we do have desktop computer guidelines. So we have the CSA standards, we have ISO and ANSI that we can refer to, and so I think really it shows us that there's a need for us to evaluate tablets while they're in this early stage, and so we can help to build this set of recommended guidelines so that we really are trying to keep our workers safe and not increase the risk of injuries. I think what we really want to try to do is sort of take what we know about desktop computers and apply it to tablet ergonomics as best we can. I know that it will be a little bit challenging because it's not the exact same, but we want to take some of those tips and then apply them. Just to summarize some of the challenges, a laptop, even if you were using it at your desk on a flat surface, for example, it's impossible to get good posture. You have to look down at the screen because it's low, it's small, and then you're typing on a small keyboard, so sometimes even just the size of the keyboard can cause awkward wrist postures for some people. And then even if you were to try to raise the monitor up so that it was at a better height so you could view it with better neck postures, it's then going to cause awkward shoulder postures. Now it's going to be too high, you're going to be working with the keys well above your elbow height, and so really no matter which way we try to look at a laptop, it doesn't allow you to get into a proper setup, right? It's even worse when you're out in the field, right? But we know that even when you're at a desk, it's impossible to get proper postures. Similarly to tablets, again, we're seeing a smaller screen, we're looking down at it, and the kind of added challenge really with a tablet is that it's all in one, so you end up seeing a lot of unilateral hand use, so holding the tablet with one hand and then typing or doing data entry with the other hand, whereas a laptop, it's very rare that you actually physically hold the laptop. Maybe it sits in your lap, but you usually have both hands available for doing the typing. And then sometimes just the screen size itself can be a challenge. If you're trying to look at a form, or maybe your vision's not fabulous and you need larger font size, it can be a challenge to view on a small screen. You end up, even if you try to increase the font size, you end up doing extra scrolling to make sure that you can see your whole form, for example. So that covers some of the challenges with the tablets and laptops, and then to go along with that, some of the discomforts that we're seeing come up more often, related to the neck, the upper back, the shoulder, wrist, the forearms, the fingers, the thumbs. We're seeing a lot in those areas, and since tablets are still relatively new in the workplace, these are more preliminary reports. They seem fitting with the postures you see people using. When they're using a laptop, they're looking down, they're hunched over their tablet or even their smartphone, so it's not really surprising that we are seeing more neck and upper back injuries or discomfort reports. They're in that hunched over position, and on top of how much we already are using smartphones, it's adding to how much of our day or how much time we actually spend in these awkward postures. I can only suspect really that the frequency of these injuries is going to increase, which is why I think it's so important that we take action now, kind of in these early stages, to try to prevent those injuries. So we need to look for ways where we can still maintain the efficiency that the tablets promote, but still we want to think about working with better postures, using better work methods. Otherwise our efficiency and productivity is just going to be reversed. Once an injury happens, it's quite debilitating. It's definitely going to slow you down, and therefore there goes your efficiency and productivity right out the window. This is a question I pose to you who are listening in. So knowing that laptops and tablets are not great for neck, back, shoulder, wrist postures, what have you been doing in your workplace to help with preventing injuries? Or if an injury has already happened, unfortunately, what have you done as an accommodation for those using laptops and tablets? So what kind of unique or creative or even simple solutions have you come up with? And so you can use the chat bar to share your experiences. We love hearing the stories and experiences that you're having. It really helps us to learn and grow as well, and especially because they're still relatively new in the workplace, but their use is really quickly rising. It's really intriguing to us to see what other people have been doing. When you are thinking about ways to improve the usage, like ways to improve postures when your workers are out in the field using laptops and tablets, there's several guidelines out there on how to set up a typical desktop computer, and even for those who are using a laptop, if you're using a laptop as a desktop computer, the guidelines are really that you provide the equipment to mimic a desktop computer. So you would pretty much use your laptop, the ideal would be to use your laptop almost like a hard drive, plug a monitor into it, plug a keyboard and a mouse into it, or prop the laptop up on a riser or a stand so that the monitor was at a good height, and then still plug in an external keyboard and mouse. Really, those are the guidelines that are available for desktop and laptop computers. And when you're not working at a desk and you're out in the field, a tablet can be a great way to improve efficiency. It can save you a lot of time in data entry or transcribing notes because you're doing it right there on your tablet. And it can give us a lot more ways to engage and communicate with our customers, right, with being able to show them pictures. But since it's impossible to really achieve that perfect neutral posture, you really want to think about the tasks that are being performed when you're using the tablet out in the field. So this is going to help to guide you on where you're going to focus your efforts to applying some ergonomic solutions. So here are two very general places to start. So if your workers are doing tasks that are mostly visual, so they're not doing very much keyboard input, then you're probably going to want to focus on some solutions that improve neck posture. And you're going to worry a little less about wrist posture because they are looking at the screen more so than they are typing on the screen. But if their tasks are involving more input, so they're using the keyboard or a mix of the keyboard and visual tasks, then you're going to want to focus on the wrist postures or the shoulder postures, first. And that's going to, in theory, that means that it's more important, or they're at an increased risk for the shoulder and wrist injuries as opposed to the neck, because they are doing more typing as opposed to just looking at the screen. So those are two just general ways to start, and then I've got a whole series of slides coming up that they're going to have a variety of possible ergonomic solutions and things to take into consideration. It's not likely that you would need all of these for one worker in particular, but after you do that initial evaluation of how your workers are using tablets and even the laptops and what types of tasks they're doing, you'll be able to identify some of maybe you're already seeing some of the challenges, or you have staff that are reporting some challenges or discomforts. You're going to be able to go through these lists, the list of options, and pick some that could work. So some of the couple ones that you might want to start with is one, just trying to simplify what it is that your workers are inputting. So if you've got a checklist or a form that they need to fill out, if you can look for ways to simplify it, maybe make it more of a checklist format, or see if you can use more drop-down menus, basically any way where they're doing less writing, then that can really help to speed up the time that it takes for them to fill out the form, as well as, then they're not having to do as much typing, especially if it's something that's repeated something that can be a checklist or a drop-down menu. It just saves a lot of time even in just typing, and then also saves your posture. Many people might find that a stylus works better, so something that's similar like a pen, as opposed to doing typing with their fingers, so they can just write on the tablet and it transcribes it to text. And similarly, there are a variety of apps out there. So I know with the Apple products, for example, they have Siri, so you can talk and it will transcribe your voice into text. And there are, other Android companies and stuff have apps for that as well. In the right situation, you might even be able to use an external keyboard, so just plug in a small little keyboard that can be stowed in your bag. Obviously, this isn't going to work everywhere, because if you are going, door to door, for example, then you're not going to have a spot to actually rest down a keyboard, so you might want to consider some of those other options first. Other things to consider would be for if you're carrying your tablet or your laptop. So there are a whole variety of different products out there. I've just got a couple of sample ones here, not necessarily from any one brand in particular, but different carrying straps. Again, like the staff member I saw in the library who had a strap on her laptop, much like an over-the-shoulder purse. There's an example where when she's not interacting with a customer, she doesn't have to physically hold the tablet in her hand, so it gives her hands a break from holding it. A tablet's not super heavy when you think about it. It is lightweight, but if you're having to carry it for several minutes, several hours at a time, it can actually be more straining on your hands and your arms. You could even consider different handhold straps. So the one that I have pictured here, it kind of grips around onto the tablet, it velcros onto your hands, so you get a nice secure fit. And this one in particular rotates, so you could choose to look at your tablet in a portrait view or landscape view. And then if you're doing more carrying, there's an example one here where it's more of like a backpack, which I think is interesting. So this can be applicable more for laptops as well. So if you're doing to carry your laptop long distances, I prefer a backpack as opposed to just a one shoulder strap bag, just because it helps to distribute the weight more evenly across two shoulders. It can be less fatiguing. There's a whole variety of stands and cases out there on the market, and you want to kind of look at some of the features that those stands and cases are offering and see which one's going to fit. You don't want something too flimsy if you're going to be on the go. You might want something that's a little bit more flexible, or that can be angle adjustable if you're going to be out. If you're going to be right flat on a table, if you're always going to have a flat, hard surface to set it on, then some of the more simpler designed stands might be good for you. But if there's, for example, the folio, the one at the bottom there, the beige colored one, that one's kind of nice in the sense that it has a cover built into it, so it covers the screen when it's in your bag, so you don't get scratches, and then when you open it up, you can kind of flip it around and make it into a stand. But if you're going, again, let's say you're holding it, you're going to be holding it in your hand for a lot of the time. Sometimes that extra case, that front cover, can actually get in the way. It's just one more thing to have to deal with. So, that's not always the best option. And then again, if you're, always in a vehicle, then maybe some of these stands aren't really going to work because there's never a flat enough surface or a stable enough surface to actually set your tablet up on. So you really need to think about, how and where you're going to be using your tablet as to know which stand is going to be the best fit. Mounting arms are kind of an interesting idea as well. So these usually are height adjustable or angle adjustable, depth adjustable, kind of a couple different options here. As with the stands, they often hold it in a fixed position. Usually there's maybe one angle that they can adjust to, or two or three if you're getting a more diverse stand. And the mounting arms are similar. The one on the left here, that would just mount or suction cup onto, let's say, your dashboard in your vehicle, or onto a desk or a counter. And then the one on the right has a few more features, so it can actually go up and down and in and out, and it's kind of an interesting application that maybe it can sit right beside you, right at your desk, for example, and be a little reference screen when you're working on a laptop as well, or a tablet, or like a desktop screen. Other things that you don't want to forget, regardless of if you're going to choose any of those other ergonomic solutions, is to always remember this work method or these work method solutions. So whenever possible, try to limit the amount of time. Again, if you're thinking about what causes MSDs or what causes those strains and sprains injuries, it's when we start combining risk factors. So if you're going to be doing something repetitive, at least do it in a good posture, minimize the force, that kind of thing. So if we know a tablet causes awkward postures, so we want to try to reduce the amount of time that we spend in those awkward postures. And definitely we want to try to move. Sometimes when we sit with our smartphones or our tablets, even though we might be in a comfy position, I mean, just think about how you might use your phone or your tablet at home, often on the couch. An hour can go by, you're just sitting there flipping through, watching videos, checking your social media, whatever it might be. And even though you're comfy, you're laying down on your couch, it's been an hour and you get up and you're like, oh, I feel a little stiff, right? So it's really important to make sure that you're moving. And so some of those field workers, this might not necessarily be a big issue for them because they are always on the go. Taking breaks, trying to rotate tasks, so tablet work versus non-tablet work. Anything like that you can do to kind of keep moving and limit your exposure time is really good. And then when you do have the opportunity, try to set yourself up into this desktop computer mode. So again, here's a picture of somebody using a laptop. They've got the laptop propped up so the screen's at a good height. They've plugged in an external keyboard. They're sitting in a chair with their back supported and their feet. That really is one of the best postures when you're working at a computer. So whenever possible, if you're having to do computer type tasks, you want to be sitting in a posture that looks as close to this as possible. Companies often issue their own policies. They tend to focus on privacy, confidentiality, and personal use. Sometimes they kind of skip the element of health and safety, or there may not be a strong focus on it. So it's important, I think, to not miss that piece. If you're going to have your workers using tablets and laptops, whether it be in the field or in the office, whichever it might be, I think you want to make sure that you do touch on that health and safety focus and really make sure that you are providing them with the appropriate accessories that they need to do their job tasks. So that's when you're going to want to look at it with that ergonomic eye. So again, like we went in those previous slides, think about what they're going to be doing. Where are they going to be using it? How long do they need to be using it for? That's going to help you to kind of guide in what accessories you may or may not need to provide to them. But remember, you're providing them with the tools that they require to safely do their job. And in all cases, education is a great way to help prevent injuries. So if you have given them accessories, or we want to educate people on how to use them, or why they should sit in different postures, why they want to move around, all of those things are really important. Sometimes it can seem like it's simple or common sense, but let's not overlook the fact that sometimes people need to be told. and education really is one of the best methods for prevention, as long as it's part of a comprehensive program. And then again, since tablets are still relatively new, you're going to want to monitor any solutions that you do implement and make sure you follow up on them. And it'll be a progressive change. Like you'll be constantly moving forward and trying to evolve. So ergonomics, any questions that you have related to ergonomics, whether it be tablet or laptop, or ergonomics in general, like I mentioned earlier, we love to hear your stories and feedback. And if you've got any kind of challenges that are going on right now, don't hesitate to give us a call. We're always open to helping you out with we can chat over the phone, we can have a free little 30-minute consultation, we can discuss your laptop, your tablet challenges, and help steer you in the right direction, provide you with some resources that might help you out. If you have any questions, please feel free to get in touch with us, info@proergonomics.ca, or our phone number. You can visit our website for additional resources as well. It's proergonomics.ca. Thanks so much for attending today. I hope you learned some tips that you can apply to your workplace to address, some of the challenges you might be having or some of the requests you might be getting. And don't hesitate to give us a call if you have any further questions. Hopefully you can join us for our next webinar. Next month we're going to be talking about return to work and ergonomics, so getting it right the second time. Jennifer McGillis is going to be presenting, and really she's going to be talking about how you can use some of those return to work challenges or some of those cases that you might be dealing with and really looking at them from a little bit of a different angle to see, as much as you're working with trying to get that employee back to work, have we taken all of the steps, or is there anything further that we can look at to make sure that this issue doesn't happen again, whether it be to the same employee or to another employee, right? We don't want to have multiple claims or issues from the same type of thing. So making sure that we're making the best out of the challenges that we are presented with. So thanks everybody, have a great day, and we'll see you soon.